Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, we're continuing our review of the 2025 ICD-10-CM official coding guidelines. All right guys, let me minimize my box. And we're going to go to my outline that shows that we're starting at Chapter 21, Factors Influencing Health Status and Contact with Health Services. Notice it's saying factors influencing. So these codes can be found between Z00 through Z99. On my handout, yep, that's where we're at. All right, I got a note that says this chapter starts with a note. So let's refer to the guidelines and see what this note says. Note says the chapter-specific guidelines provide additional information about the use of Z codes for specified encounters. Okay. I've got a Code Master Coach note here in purple that says whenever you see a Z code, just know that this code usually represents information that can assist a diagnosis. Codes such as BMI, when the physician diagnoses the patient, say, morbid obesity. Well, to justify the morbid obesity, he has to give a BMI, your body mass index. That's a Z code. Your allergy status, the fact that you're allergic to penicillin or any other oral meds or any other kind of medications, those are Z codes. Your weeks of gestation, when you're pregnant and you're coming in for your prenatal visits, or even when you deliver, we identify the weeks of gestation of the mother so we can identify where certain conditions, what time period they usually originate. Or even well exams, because think about it. When you have a diagnosis, fine, but when there's nothing wrong with you, when you don't actually have a condition, what are we coding? We're coding a well exam. Well, those will come in at a Z code. So I always teach my coders to get to know your codes. Don't memorize. I'm not asking you to memorize. I'm saying get to know your codes. Codes that start with an S or a T are usually injury codes, some type of injury, whether it's a laceration or a gunshot wound or some type of open wound. B codes are like the infectious organism, like Streptococcus or Staphylococcus, E. coli. Your C and D codes usually are neoplasm type codes. Your E codes are your diabetes codes and your hypo or hyperthyroidism codes. Your F codes are your psych codes, overdose, drug abuse, etc. Get to know your codes to a point where when you see a Z code, you know that yep, this code is going to assist with the diagnosis. It's not a true, and it can be a true diagnosis. I don't want to say it's not a true diagnosis when you're going for a well exam. A well exam is a well exam. You're going in for an examination. They don't find anything wrong. What do we code? It's going to be a Z code because there's nothing wrong. Now, had they found something on a well exam, you go in and they find hypertension or diabetes, then we get off of the Z code and we code what's wrong. Okay, so just remember those notes. And then we start with use of Z codes in any healthcare setting. A, let's see what it says. Z codes are for use in any healthcare setting: inpatient, outpatient, observation, emergency room, same-day surgery, etc. Z codes may be used as either a first listed, which is considered your principal diagnosis in an inpatient setting, or a secondary code, depending on the circumstances of the encounter. But remember, certain Z codes may only be used as first listed or principal diagnoses. Let me go to my handout. It seems like, I've got a note here that says, remember that certain Z codes can only be a principal diagnosis, and others can only be a secondary diagnosis. So be sure to read the notes at each code, because it'll tell you at the code if it can only be a principal diagnosis or if it can only be a secondary diagnosis. All right, B, Z codes indicate a reason for an encounter or provide additional information about a patient encounter. Z codes are not procedure codes. A corresponding procedure code must accompany a Z code to describe any procedure performed. Say you're going in for that well exam, and the procedure code will be the evaluation and management for that well exam. So anyway, Z codes indicate a reason for an encounter, even if there's not a true reason. Okay? C, categories of Z codes. Number 1 talks about contact and exposure. So let's see what one says under C. Category Z20 indicates contact with and suspected exposure to communicable diseases. These codes are for patients who are suspected to have been exposed to a disease by close personal contact with an infected individual or are in an area where a disease is epidemic. And guys, we saw a lot of that with COVID. When COVID broke out in 2019, 2020, 2021, a lot of us came in contact with. Now, with that Z20, you're coming in because you had contact. Had you tested positive for COVID, we would use the COVID code. But just identify the fact that you're coming in because you were exposed to or were in contact with somebody, to justify the testing, it's going to be a Z20 code. Category Z77, other contact with and suspected exposures hazardous to health, indicates contact with and suspected exposures hazardous to health. Contact or exposure codes may be used as a first listed code to explain an encounter for testing, or more commonly as a secondary code to identify a potential risk. Let me check my outline. It seemed like I had a note. Yeah, my note just says the code is a Z code until confirmed. So when you're coming in for contact or exposure to, it's a Z code. But if while testing it comes back confirmed that you do have COVID, rabies, etc., then we'd code that condition instead of the Z code. But just for the visit for the contact or the exposure, it's going to be a Z code until confirmed. All right, we're down to number 2, inoculations and vaccinations. Refer to the guidelines. Number 2, code Z23 is for encounters for inoculations and vaccinations. It indicates that a patient is being seen to receive a prophylactic inoculation against a disease. Procedure codes are required to identify the actual administration of the injection and the type or types of immunization given. Code Z23 may be used as a secondary code if the inoculation is given as a routine part of preventive health care, such as a well baby visit. So again, remember with these inoculations and vaccinations, if you're coming in for, say your child is due for their annual inoculation or vaccination, whatever it may be, you're going to code that Z23, and then you're going to use a procedure code to identify the administration of the vaccination or inoculation, as well as the immunization itself. But if it's part of a well baby check, and part of the well baby check at 6 weeks is to give the baby some type of vaccination or inoculation, then the Z code is a secondary code because the well baby check is the reason for the encounter. And then while they're there, they're going to give the vaccination or inoculation. So then the Z code, the Z23, in this case, would be an additional or a secondary code. Make sure my 2 is straight from the guidelines, straight from the guidelines. Number 3, status. Status. It says refer to the guidelines. So with status codes indicate that a patient is either a carrier of a disease or has the sequela or residual of a past disease or condition. This includes such things as the presence of prosthetic or mechanical devices resulting from past treatments. So if they have an artificial limb, hip, knee, shoulder, etc., and you want to identify the fact, oh, by the way, they have an artificial joint. A status code is informative because the status may affect the course of treatment and its outcome. A status code is distinct from a history code. Let me say that again. I've got it in pink. A status code is distinct from a history code. The history code indicates that the patient is no longer has the condition. History codes indicate that the patient no longer has the condition. Status code should not be used with the diagnoses code from one of the body system chapters if the diagnoses codes includes the information provided by the status code. And they gave you example. Code Z94.1, heart transplant status, should not be used with the code from subcategory T86.2, complications of heart transplant. The T86.2 already provides the fact that the patient has a heart transplant. So it says the status code does not provide additional information. The complication code, the T86.2, indicates that the patient is a heart transplant patient. So it's kind of double coding if you did that. So you don't need the status code if the code, the complication code, already indicates what the Z code was, or the status code was indicating. And for encounters for weaning from a mechanical ventilator, assign a code from subcategory J96.1, chronic respiratory failure, followed by code Z99.11, dependence on respirator, ventilator status. And the status Z code categories are Z14, which is a genetic carrier. And just know that genetic carrier status indicates that a person carries a gene associated with a particular disease, which may be passed to offsprings who may develop that disease. The person does not have the disease and is not at risk of developing the disease. And what comes to mind immediately to me is sickle cell trait. There's a difference in sickle cell disease and sickle cell trait. A person can have the trait but not have the disease. However, if they mate with someone who does have the trait, and they have the trait, they have a 1 in 4 possibility of having a sickle cell child, a child with sickle cell. So a genetic carrier is a Z14. They're just status. Oh, by the way, they're a carrier. Z15 is genetic susceptibility to disease. Genetic susceptibility indicates that a person has a gene that increases the risk of that person developing the disease. Codes from category Z15 should not be used as principal or first listed codes. Probably need to highlight that one because that stands out. Codes from category Z15 should not be used as principal or first listed codes. Highlight that in your book, make a note there. If the patient has the condition to which he or she is susceptible, and that condition is the reason for the encounter, the code for the current condition should be sequenced first. If the patient is being seen for follow-up after completed treatment for this condition, and the condition no longer exists, a follow-up code should be sequenced first, followed by the appropriate personal history and genetic susceptibility codes. And if the purpose of the encounter is genetic counseling associated with procreative management, then code Z31.5, encounter for genetic counseling, should be assigned as the first listed code, followed by a code from category Z15. And it says the additional code should be assigned for any applicable family or personal history. We're going to talk about that in a little more detail in just a minute. Code Z16, resistance to antimicrobial drugs. This code indicates that a patient has a condition that is resistant to antimicrobial drug treatment. Sequence the infection code first. Z17, estrogen and other hormone and factor receptor status. Z18, retained foreign body fragments. Z19, hormone sensitivity malignancy status. Z21, asymptomatic HIV infection status. It says this code indicates that a patient has tested positive for HIV but has manifested no signs or symptoms of the disease. So it's kind of like they're carriers. So that's a Z21. They're asymptomatic. They haven't had any symptoms. It's a Z21. And remember our guidelines on HIV. When they test positive but show no signs, it's a Z21. But once they ever manifest signs or symptoms, they're a full B20, and they can never come back to a Z21. Z22 is carrier of infectious disease. Carrier status indicates that a person harbors the specific organism of a disease without manifest symptoms and is capable of transmitting the infection. So they're carriers of the infectious disease. Z28.3, under immunization status. Z33.1, pregnant state incidental. Says this code is a secondary code only for use when the pregnancy is in no way complicating the reason for the visit. Otherwise, a code from the obstetric chapter is required. So it's saying here Z33.1 is in those instances when a patient comes in, say for a broken leg, so something totally unrelated to a pregnancy, but by the way, the patient is pregnant. They're coming in for something totally unrelated, and that's why, but we want to identify the fact that the patient is pregnant. We're going to use a Z33.1 as a secondary code. Because otherwise, if it's a pregnancy-related condition, that pregnancy code, obstetric from the obstetric chapter, is going to be your principal first listed code instead of Z33.1. Z66 is the do not resuscitate code. This code may be used when it is documented by the provider that a patient is on the do not resuscitate status at any time during the stay. Z67 is the blood type. Z68 is that body mass index, BMI. It says BMI code should only be assigned when there is an associated reportable diagnosis such as obesity, and do not assign BMI codes during pregnancy. You might want to highlight that. Z7401, bed confinement status, identifying the fact the patient is confined to a bed. Z76.82, awaiting organ transplant status. Z78, other specified health status. And it says here code Z78.1, physical restraint status, may be used when it is documented by the provider that a patient has been put in restraints during the current encounter. Please note that this code should not be reported when it is documented by the provider that a patient is temporarily restrained during a procedure. Okay. Z79 is long-term or current drug therapy. Codes from this category indicate a patient's continuous use of a prescribed drug, including such things as aspirin therapy, for the long-term treatment of a condition or for prophylactic use. It is not for use for patients who have addictions to drugs. And it says this subcategory is not for use of medications for detoxification or maintenance programs to prevent withdrawal symptoms, such as methadone maintenance for opiate dependence. Assign the appropriate code for the drug use, abuse, or dependence instead in that case. But if they're on a long-term use of, insulin for diabetes or Coumadin for the blood thinner, then it should be captured as a Z79 code. Assign a code from Z79 if the patient is receiving a medication for an extended period as a prophylactic measure, such as the prevention of deep vein thrombosis, or as a treatment of a chronic condition such as arthritis, or a disease requiring a lengthy course of treatment such as cancer. Do not assign a code from category Z79 for medication being administered for a brief period of time to treat an acute illness or injury, such as a course of antibiotics, or to treat an acute bronchitis. Those are just temporary. Those are not expected to be long-term, so don't use the Z79 in those cases. Z88, allergy status to drugs, medicaments, and biological substances. It says except Z88.9, allergy status to unspecified drug, medicaments, and biological substance status. Z89, acquired absence of a limb. Z90, acquired absence of organs not elsewhere classified. Z91.0, allergy status other than to drugs and biological substance. Z92.82, status post-administration of TPA or RTPA in a different facility within the last 24 hours prior to admission to a current facility. And it tells you to assign code Z92.82, status post-administration of TPA in a different facility within the last 24 hours prior to admission to current facility as a secondary diagnosis when a patient is received by transfer into a facility and documentation indicates that they were administered tissue plasminogen activator, TPA, within the last 24 hours prior to admission to the current facility. This guide applies even if the patient is still receiving the TPA at the time they are received into the current facility. The appropriate code for the condition for which the TPA was administered, such as a cerebral vascular disease or myocardial infarction, should be assigned first. And then code Z92.82 is only applicable to the receiving facility record and not to the transferring facility record. Z93, artificial opening status. Z94, transplanted organ and tissue status. Z95, presence of cardiac and vascular implants and grafts. Z96, presence of other functional implants. Z97, presence of other devices. Z98, other post-procedural states. It says assign code Z98.85, transplanted organ removal status, to indicate that a transplanted organ has been previously removed. This code should not be assigned for the encounter in which the transplanted organ is removed. The complication necessitating removal of the transplant organ should be assigned for that encounter. Z99, dependence on enabling machines and devices not elsewhere classified. And it gave you a note here. Categories Z89 through Z90 and Z93 through Z99 are for use only if there are no complications or malfunctions of the organ or tissue replaced, the amputation site, or the equipment on which the patient is dependent. So make sure you keep that note highlighted in your book right there. Those categories are for use only if there are no complications or malfunctions of the organ or tissue replaced, the amputation site, or the equipment on which the patient is dependent. All right, let me check my outline for 3. That's just it for status. Now, history. Refer to the guidelines and then refer to the scanned documents. Okay, so let's go to the guideline for 4. History of. There are 2 types of history Z codes, a personal and a family. Personal history codes explain a patient's past medical condition that no longer exists and is not receiving any treatment, but that has the potential for recurrence and therefore may require continued monitoring. So notice history has 2, personal and family, but with personal you no longer have the condition, but it has the potential to reoccur. With family history codes are for use when a patient has a family member or members who has had a particular disease that causes the patient to be at a higher risk of also contracting the disease. Personal history codes may be used in conjunction with follow-up codes, and family history codes may be used in conjunction with screening codes to explain the need for a test or procedure. History codes are also acceptable on any medical record regardless of the reason for the visit. A history of an illness, even if no longer present, is important information that may alter the type of treatment ordered. The reason for the encounter, for example, screening or counseling, should be sequenced first, and then the appropriate personal and or family history should be assigned as additional diagnoses. And you have your history Z code categories. Z80, family history of primary malignant neoplasm. Z81, family history of mental and behavioral disorder. Z82, family history of certain disabilities and chronic diseases. Z83, family history of other specific disorders. Z84, family history of other conditions. Z85, personal history of malignant neoplasm. Z86, personal history of certain other diseases. Z86, personal history of other diseases and conditions. Z91.4, personal history of psychological trauma, not elsewhere classified. Z91.5, personal history of self-harm. Z91.81, history of falling. Tend to see that a lot of nursing home patients' charts. Z91.82, personal history of military deployment. Z91.85, personal history of military service. Z92, personal history of medical treatment, and it's got an except. Z92.0, personal history of contraception, and another exception, Z92.82, status post-administration of TPA in a different facility within the last 24 hours prior to admission to a current facility. So let me go back to my guidelines for history of, okay, and then I wanted to show you an alphabetic index, in your alphabetic index, how to identify the difference between history personal or family. So this is a replica of my alphabetic index, and if you go down the main term history, notice it starts with family because F comes before P. So make sure when you're identifying your history of, if it's a family history, then anything indented under family applies to family history, and then go down to personal. For personal history, anything under personal, anything indented, identifies history of personal history codes. So what I always remind my students is to highlight family, the subterm under the main term history, highlight family, and highlight personal, so that you know that anything under each of those subterms identifies information pertaining to family history or personal history. And then we're down to screening, number 5. Screening is the testing for disease or disease precursors in seemingly well individuals so that early detection and treatment can be provided for those who test positive for the disease. After a certain age, or unless there's a family history or personal history, you can get mammograms, and these are screenings to prevent. These are disease precursors. The testing of a person to rule out or confirm a suspected diagnosis because the patient has some signs or symptoms is a diagnostic examination and not a screening. Let me make sure I stress that again. The testing of a person to rule out or confirm a suspected diagnosis because the patient has some sign or symptom is a diagnostic examination and not a screening. In these cases, the sign or symptom code is used to explain the reason for the test. A screening code may be a first listed code if the reason for the visit is specifically the screening exam. It may also be used as an additional code if the screening is done during an office visit for other health problems. A screening code is not necessary if the screening is inherent to a routine examination, such as a pap smear done during a routine pelvic exam. In that case, that pap smear is not a screening. It's done routinely with your pelvic exams. So it's not necessary to use it as a screening code. Now, should a condition be discovered during the screening, then the code for the condition may be assigned as an additional diagnosis. You're still coming in for the screening. Your screening code is still your principal, but if they do test positive or find that the condition does exist, then you can use that condition or assign that condition as an additional diagnosis code. The Z code indicates that a screening exam is planned, and a procedure code is required to confirm that the screening was performed. And then a list of your screening codes or categories are Z11, encounter for screening for infectious and parasitic diseases; Z12, encounter for screening for malignant neoplasm; Z13, encounter for screening for other diseases and disorders. There's an except. Z13.9, encounter for screening unspecified; Z36, encounter for antenatal screening for mother. And then it goes into 6. Are we covering 6? Nope, 6 will be in our next video. Okay, guys, that's a full screening of Z codes. Just take some time this week and go through your Z codes and get to know them and learn your disease processes and get familiar with your coding. Okay, guys? All right, if that's it, I will see you in the next one. Continue to stay in your code books, guys. Thanks.